Welcome back to Capitol Tonight. Last week, after over a decade of trying, advocates rejoiced when the New York State Assembly passed a bill allowing for medically assisted suicide. After an emotional debate, the so-called Medical Aid in Dying Act passed by an 81-67 vote. The legislation faces an uphill battle in the state Senate, but if passed into law, it would allow mentally competent terminally ill patients over the age of 18 to self-administer physician-prescribed, life-ending medication. The bill is strongly opposed by some members of the disability rights community and the New York State Catholic Conference. Today, we're going to be hearing from both those opposed and those in support, beginning with the opposition. Dr. Diane Meyer is a recipient of the MacArthur Genius Grant. She's a doctor of internal medicine at Mount Sinai Hospital, the immediate past CEO of the Center to Advance Palliative Care. And her most recent book is Meeting the Needs of Older Adults with Serious Illness, Challenges and Opportunities in the Age of Health Reform. It was published in 2014. Welcome, Dr. Meyer, to Capitol Tonight. It's great to have you.
Thank you so much for inviting me.
Perhaps you could start by explaining why you're against passage of this bill. What specific concerns do you have?
Let me begin by saying that when I was younger, I was strongly in favor of it and very committed to the rights of individuals to control the timing, setting, and nature of their own death. And then as I practiced for longer and took care of a lot more patients, I increasingly was caring for people who came to me wanting suicide, wanting my help with suicide. And when I took the time to explore what led them to decide that life was no longer worth living under the circumstances imposed by this illness, many people described things like feeling like a burden. Many people describe things like fear of future pain and distress, fear of the actual dying process. And we spent time talking about what we can do in medicine and in palliative medicine in particular to control symptoms and to support family caregivers. And remarkably, when people had a chance to name their concerns and their fears and were able to connect to a clinician who could address those issues, overwhelmingly, people no longer wanted to be dead. They wanted to stay here as long as they could and be with their loved ones and taste of the miracle of being alive on the planet.
Do you think then that this particular bill, which I'm assuming that you've read, doesn't contain the sort of safety net that you would expect it to, in order to basically weed out people who simply don't want to be alive anymore? I mean, there's a lot of concern over young people, for example, who want to commit suicide, members of the LGBTQ community who want to commit suicide. This is specifically for terminally ill patients, but you don't think there's a safety net here?
Well, first of all, there's no requirement in the bill that every patient has access to and receives palliative care support during that process of exploring whether or not they'd rather be dead. There's no requirement that people have access to psychological support, counseling, spiritual support or counseling. Overwhelmingly, almost everyone who has a serious life-threatening illness has passing thoughts of, I don't want to deal with this, I'd rather not be here. That's normal. But what the bill fails to do is provide people with the support and guidance that might allow them to regain a joy in being alive and a willingness to be alive. And none of these bills provide that. And if you look at other states, other jurisdictions in other parts of the world, those safeguards of being terminal, et cetera, even being an adult over 18, they've all fallen away. Because who's to decide who's terminal? Who's to decide that depression is not just as much misery and suffering as metastatic cancer? So the barriers drop one by one as people get accustomed to the notion that medical aid in dying is just fine.
I think, though, that there is a line. I mean, if somebody has a terminal cancer, if somebody has ALS, and you can get a consensus among doctors that this person is going to die within 6 months. The question that some of these folks have is, am I going to experience incredible pain? And as a palliative care expert, can you promise that there will be no pain at the end?
I can if a palliative care expert is taking care of that person at the time of dying, because many physicians, nurse practitioners, and others have had no training in pain management. And it's an indictment of our medical schools and residencies that doctors actually don't know how to manage pain. So patients are right to be concerned because of that. When you have people who have training, if someone's pain is so bad that we can't control it and keep them awake, we will make them sleep. It's essentially general anesthesia. That is almost never necessary. I have not experienced a patient whose pain I was unable to manage. What I find the main motivation turns out to be is not uncontrolled symptoms, even though that's what the voters are thinking about when they pass these ballot measures. It's actually much more existential. I don't want to need someone to help me go to the bathroom. I don't want to need help bathing. I don't want to be dependent. And most of the people who articulate that are people like me, white, upper middle class, highly educated individuals who like a lot of control. What happens when the restrictions get looser and looser, as they have, as I said, in virtually every other jurisdiction that has passed these laws, is there starts to be an unspoken social pressure on people who are burdensome, that they should take advantage of this and stop, being
So
such
there's
a
a
weight on
psychological
society.
pressure. Sure, we've talked
Yeah.
about that on this program. We're out of time, unfortunately. We've been discussing medically assisted suicide with Dr. Diane Meier. It has been a pleasure. Thank you.
Thank you.
Welcome back to Capitol Tonight. We just heard Dr. Diane Meier discuss the reasons she is against medically assisted suicide. Joining us with the other side of the argument are two guests, Corinne Carey, the Senior Campaign Director for Compassion and Choices in New York and New Jersey, and Dr. Jeremy Boll, who is a physician who served as the Chief Clinical Officer for the Mount Sinai Health System before receiving a diagnosis of ALS, also known as Lou Gehrig's disease. It's great to see you both again. Thanks for coming in. Dr. Boll, why don't you quickly tell us your story?
Yeah, you bet. So I'm a geriatrician, and I spent the first part of my career creating a home-based primary care program for people with late-stage and terminal illnesses. I did that for about 10 years. And then I became a healthcare executive, most recently Chief Clinical Officer for Mount Sinai. And in November of 2023, I stepped down when I received my own diagnosis of ALS, or Lou Gehrig's disease.
You know Dr. Diane Meier very well.
Extremely well.
Right,
yeah.
your colleagues.
We're very good friends as well.
Okay, yeah. That's very interesting to note. You're on opposite sides of this issue. I do want to say that we spoke to Dr. Meier, Corinne, and she's against this bill for a few reasons. She says that the bill has no requirement that patients receive palliative care support to help them with dying, and that there's no requirement that there is access to psychological support or counseling. Can you respond to these concerns?
I think one thing most people don't understand is that in states that authorize medical aid in dying, close to 90% of people who utilize it are already receiving hospice care. They are connected to the best possible care, and they just want some measure of autonomy over the way that they die.
I do have to mention New York is last in hospice care in the United States.
It's true, and this is one thing that we could actually do that would increase uptake of hospice in this state.
How
and
would
make
that work?
More. Well, it opens up the conversation between patients and their providers about what people fear most about the end of their lives, and the bill actually requires that treating physicians refer people for hospice and palliative care services. It's something that we need to address, and a bill like this would help address that.
Time for a conversation about that. I asked Dr. Meier, Dr. Boll, if she could promise death without pain from ALS, which is what you're suffering from, or terminal cancer, and she said that she could if there was a trained palliative care expert assisting with care support at the time of the person's death. Do you believe that?
I don't. With the utmost respect for Dr. Meier, I think that's true in most cases. Unfortunately, having had direct firsthand experience with patients receiving the very best palliative care in hospital, in the home. In fact, I can call Dr. Meier's attention to Ayla Eilert and her parents. I'd love for Dr. Meier to have a conversation with her parents. Ayla was cared for on the palliative care service at Mount Sinai, which is arguably the best palliative care program in the country and one that she founded. And Ayla was unable to receive adequate pain relief despite having the world's best palliative care doctors at her bedside. She died in agony, begging for medical aid and dying.
I remember having her folks on.
Yeah.
Yeah. Assemblymember Mikhail Szilagyi, this bill was brought to a floor vote in the Assembly last week, and Mikhail Szilagyi voted no. And I thought that her reasoning was interesting. She said, "I'm voting no today because we live in a place where our healthcare system is a business, and access to care, including palliative and hospice care, is deeply unequal." And that's certainly true.
I don't think there's anyone in good conscience that could disagree with the fact that our healthcare system is broken in that way. The payment system is broken. Medical aid in dying gives people an option to avoid needless suffering when they are already dying. And that's all this bill does, it allows people to have a choice over the way and the time and the manner in which they die.
Is there anything that you would like our viewers to know? Because this is now the point at which this bill could pass if the Senate votes on it at some point. What should people know about this particular law?
Going back to some earlier concerns that Dr. Meyer raised, we have a 30-year history in this country of nearly identical laws in multiple jurisdictions. And as Corin mentioned, in those states, the evidence is incontrovertible that having MAID on the books actually increases utilization of palliative care and hospice care. It provides extraordinary comfort to people who will never avail themselves of it, but if they have a terminal illness, they know that they might have some control over their ultimate outcome. And the equity question has been asked and answered in that in those jurisdictions, historically disadvantaged communities do not have overrepresentation of medical aid in dying. It's just not something that's ever occurred in any of those jurisdictions.
Final question. We had Andrea Stewart-Cousins. She's the Senate Majority Leader on last week. She said this bill has 25 yes votes, or 25 sponsors, I should say, in the Senate. How many do you need?
We need 32 yes votes in the Senate, and I'll just remind you we had 65 bill sponsors in the Assembly and 81 yes votes. So we believe that if the bill were put up for a vote, this bill would pass.
Do you think it's going to be coming up for a vote in the Senate?
It needs to, Susan. We've lost so many advocates who've died in tremendous pain. We can't afford to let another year go by and let the 6 people that our campaign is working with right now have this session end without access to this compassionate option.
We have been discussing a bill called Medical Aid in Dying with Corinne Carey. She's the Senior Campaign Director for Compassionate Choices. Dr. Jeremy Bowl, he's an ALS patient and the former Chief Clinical Officer for the Mount Sinai Health System. Thank you both.
Thank you.
Thank you.
Thanks for watching our YouTube channel. For more stories in your community, click the subscribe button here. You can also download the Spectrum News app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.